Hi, I'm Greg Corombos. My guest at this time is Grace Marie Turner. She's president of the Galen Institute, one of the most respected healthcare policy organizations in the country. We want to get Grace Marie's insights on a number of important developments in recent days. First of all, what to make of the World Health Organization as President Trump announces he's going to withhold funds until a full evaluation can be done on what the WHO did and didn't do appropriately once it knew about the outbreak of this virus in China. We also want to get her insights and what she thinks about the three-phase reopening plan, essentially, of the U.S. economy and even U.S. society to some extent. So, Grace Marie, thanks so much for being with us.
Always a pleasure, Greg.
Well, let's start with the news that broke earlier this week, and that was the World Health Organization. There's been plenty of criticism from the get-go that the WHO essentially took China's word for just about everything, from whether or not this was transmissible to whether or not there needed to be travel bans to whether or not the problem had really abated in China. And each step of the way, the WHO didn't seem to have any pushback. The U.S. And others have now realized that China was not telling the truth. So what do you make of the president's decision at this particular moment to question WHO funding? Some have said it's a good thing maybe once we have this under control. Others have said, no, this demands an immediate response. What's your take?
It absolutely demands an immediate response. The WHO is absolutely complicit in the unnecessary delays in alerting the world to the danger of this virus so that we could all take appropriate action. And it is baffling to many of us why the UN and the WHO have been so solicitous to China and basically agreeing with everything they said, with the Director General of the WHO saying that if it weren't for China, the number of cases outside China would have been much higher, when in fact China lied about the outbreak. It lied about the human-to-human transmission. It lied about how incredibly contagious it is, and we believe it's still lying about the number of deaths that it's created in China. And for the WHO to be praising China for its transparency that they've just demonstrated, there has to be a price to be paid for that. It has cost lives.
Grace Marie, you've followed healthcare policy both nationally and globally for a long time. Is this par for the course for the WHO, or in previous outbreaks and other crises, have they been far more responsible?
Well, like with our own CDC, the WHO was apparently focused on a lot of other things in its core mission of protecting public health. The CDC should have been much more prepared for the testing and being able to make sure that the test could be validated than it was. It was preoccupied with a lot of other things. That's clearly not on the scale of the WHO's deceit and deception, but it's their missions. They've gotten too big and too sloppy, and they have forgotten what their core mission is: to protect the public health. They finally agreed, and not until March the 12th, the WHO to declare a public health emergency after the president had recognized what was coming at the end of January, stopping travel to China. So that 6-week delay was very serious and consequential, and they have to pay a price for it. And hopefully having the United States cut off their funding will get their attention. We may need a new change in leadership there, and we've got some very good people working with the UN who are on to this, and I believe may see that in order to reestablish some confidence in the WHO, we're going to need new leadership.
Grace Marie, you mentioned in passing with both the CDC and the WHO that they were focused on other things that may have distracted them from what their real job is, and it's to prevent and mitigate things like this. So what priorities, political or otherwise, because I think I kind of read that into your response there, were they focusing on when perhaps more attention should have been paid to what was going on with this?
Well, I think that they've been much more focused on political correctness rather than really looking at what we'd all need to be doing to prepare for a crisis like this. It's in the background. One of my colleagues would actually worked for the George W. Bush administration, and one of his main jobs in 2005 was to prepare for an outbreak like this by ramping up on the stockpiles of medical devices and protective equipment. And he said, why am I doing this? He says, there's so many other major things happening in the world. Why am I doing this? Well, now we know. You often labor in obscurity until it's really needed. But they just basically let the core missions fall aside while they were thinking about more politically correct things that would get them more media attention, apparently.
So, Grace Marie, in response to what the president has decided here, at least in the short term, you've got a lot of folks saying, even some who would admit that the WHO has not been the asset that they should have been in this situation. Look, they dropped the ball. China dropped the ball. They covered for China. But if we're really going to get this pandemic under control, we've got to have the WHO at full strength. They're paying attention now. We can deal with this later, financial repercussions, other repercussions, but we have to have them now. Why are they saying that? Is it just because they want to preserve the status quo, or is there a vital function that the WHO is providing here outside of their engagement with China that really is necessary, and any sort of reduction in funding would be compromising the mission?
The WHO certainly has a lot of staffers on the ground. If they were around the country, around the world, if they were properly focused, they absolutely could be helpful. Whether or not they are doing that is really a big question. When an organization, when the top leadership is so lacks credibility, it really makes you wonder what are the marching orders for those on the ground. So I don't think we really know, Greg, whether or not they're needed, what their function can be, whether or not they're getting proper direction, until there is attention at the top to make sure that this organization gets back to its core mission. We just don't know that right now.
Anything that you would absolutely encourage folks who will be looking at the WHO's response here, besides perhaps a change in leadership, that needs to be closely examined here in this time of evaluation?
I think actually one of the first things we could do is find out what really happened in China and is happening. We need data to know what is the death rate, how many people are diagnosed, how many people of those diagnoses, those that are diagnosed, and how the spread of contacts, how many people die from this relative to the number that are infected. All that data is needed. China was the first, clearly, in having the outbreak. So their data could inform the rest of us in knowing what we can and should do next. So if the WHO really wanted to be helpful, they could find out much more about what really happened in China and let the world know about that so we can anticipate perhaps the next wave, understanding that it is more or less infectious than we thought. China has data, but we don't have access to that. If the WHO were to get that and share that with the world, I think that would really do a lot to convince us that they are once again trying to function to their core strengths.
We're talking with Grace Marie Turner. She's president of the Galen Institute. And Grace Marie, let's talk now about the reopening strategy. Of course, the president a while back had said he hoped to be open by Easter. That did not happen, but we've pretty much been in shutdown mode for about a month now. We've got about half the month, a little less than that now, until we get to April 30th, which is as long as the mitigation factors are in place. But now the president is laying out these three different phases with the cooperation of his health officials and his economic advisors. And effectively, while still leaving the final decisions to governors in various states, looks like some phased in reopenings in areas where it's not been a problem or it's no longer a problem. It might be open sooner rather than later. And then in more hard-hit areas, it could be a little bit longer. But what do you make of the three-phase approach and the flexibility it gives to various areas rather than having one decision from on high?
I think it's absolutely right, Greg, that we have seen communities absolutely devastated economically by the shutdown, where there have been so few infections that you could count them on one hand, that the economic catastrophe is at least as serious for millions of people as the threat of the virus. So yes, we absolutely must do this. And there's no way there can be a nationwide response to the reopening, because some communities do need to continue to maintain social distancing, maybe even some isolation like New York City. But in Wyoming and southern Utah and a lot of parts of Texas, they can have sophisticated state by state, county by county, even locality by locality directions to begin to allow the economy to reopen while we still maintain necessary protection. So it's really the genius of our federalist system of government that states and localities ultimately know so much more about what's happening on the ground in their communities. And they need to be able to have the power, the responsibility, and the resources to begin to open up their communities. And I think that that philosophy is what the president is giving them the authority to do. I saw today that Texas is already taking steps to open its economy. All the state compacts in the Midwest, the West Coast, even in the harder hit areas in the New York, Connecticut, New Jersey area, they're getting together to figure out what do they need to do as a community of states to be able to help their citizens, protect their citizens, but also begin to allow the economy to function again.
Grace Marie, I'm sure you had kind of an ironic smile when you saw the sudden respect for federalism and
Yes.
state governments. We, of course, have had this debate over what the healthcare system should look like and whether Washington should be directing what that looks like. Do you think the larger healthcare debate is going to take on a more federalist feel, or once we're back to whatever passes as normal, we're going to go back to the same drawing lines on this debate?
You know, the central planners just don't ever seem to give up. Now they want to be deciding, for example, where do we need additional hospital capacity, and throwing hundreds of billions of dollars at hospitals so they can create new beds. My colleague Doug Badger has a new paper out with the Heritage Foundation that explains the United States has more acute care beds by a factor of 2 or 3, for example, than European countries. We have 2 or 3 times more intensive care beds. We may have fewer acute care beds, but many of them are not occupied because we do so much more outpatient surgery in the United States. So there's no way the federal government can do a blanket solution on hospital capacity. All of those decisions need to be made locally. So it's just sort of a long way of saying, no, they're not going to give up. They're going to still want to control all this from Washington. They're going to throw hundreds of billions of dollars in deficit spending taxpayer dollars to try to solve a problem that may not exist. So if we can use this example, not only of local control, but of a lot of the things that have happened to relax rules and regulations so that the health sector can function better, allowing telemedicine, beginning to allow doctors and nurses to practice at a higher level of their training certificates, allowing the kind of relaxation of rules and regulations has really opened the health sector to be able to be responsive. FDA rules and regulations that are allowing drugs to get to market and to be tested much faster. All the things that Washington loves to control by the rules and regulations, we've seen, hey, the health sector actually functions better if we get those out of the way. So we are going to do everything we can to explain to the American people that when we have seen good responses to needs, we have seen the private sector stepping up, coming up with tests, producing supplies, turning automobile factories over to be able to produce ventilators. Where we have seen failures, it's been in central controlled government programs like the Center for Disease Control, really delaying by a month getting tests out to be able to begin the process of finding out who actually does have the virus. So the failures have been of government, the successes have been in the private sector. Hopefully that's a lesson that we can learn from this and get away from this Medicare for all nonsense that would cripple our health sector.
Grace Marie, exit question. If you had been told in mid-March or at the beginning of April that by April 16th we'd be talking about a reopening strategy, would you have taken that in a heartbeat or been surprised that it took that long?
Oh, I would have taken it in a heartbeat. And I really did think that we were probably in for another at least 10 days, maybe even 2 weeks of this lockdown. So I'm really pleased that the president said he hoped by Easter. Almost nobody thought that was possible, but it is still Easter week. And it's actually, I think, some Orthodox Christian faith, it's not Easter yet. So
Yeah, it's coming this Sunday for them. Absolutely.
exactly. So I think that this is showing how that this balance of understanding the virus, containing the people who are infected, contact tracing, more testing, isolating people who are infected, not putting them in families and reinfecting others that they're living with, being able to learn sophisticated lessons from other countries, from what works here, will get us back on track and allow us to be able to have a functioning economy again.
Grace Marie, we will call time there. Have an excellent weekend. Thanks as always for your great analysis.
Thank you, Greg.
Grace Marie Turner, president of the Galen Institute, one of the most respected healthcare policy organizations in the nation. I'm Greg Corombos, reporting for Radio America.